Okay, so we're going to have some more fun with primal and the hip joint itself. I think this is an interesting picture for us to look at. Obviously, we have the femoral head, femoral neck, femur itself, the acetabulum here, pelvis. Okay, this would be the fovea of the femur. The green component here is actually the ligament of Peres. As you know, that is where the blood supply to the head of the femur comes from in our youth. If we carefully look at this, now we have the intra-articular fat pad within the acetabular fossa, which would be over in here, the acetabular fossa. The articular cartilage of both the acetabulum and the femur is highlighted in green for you. The articular cartilage is hyaline in nature, so it's a hyaline articular cartilage. As you know, this is a synovial joint. What you can't see in this picture is the orientation of the articular cartilage within the acetabulum. It's lunate or moon-shaped, and there is a small notch pointing down at the acetabular notch. The lunate surface is broader in its upper portion and narrower anteriorly. It is covered by hyaline cartilage, which is at its thickest superiorly, which makes sense because that's where we're bearing most of the weight. This is the acetabular labrum. It serves to deepen the acetabulum and increases the stability of the joint. The addition of the labrum ensures that at least 50% of the femoral head is covered by the labrum ensures that at least 50% of the femoral head is covered in any position of the hip motion. A normal hip will typically extend 20 to 30 degrees, flex 135, abduct 45 to 50, adduct 20 to 30, and have a combined arc of rotation of 90 degrees. The extent of internal and external rotation may depend on the amount of anteversion of the femoral neck. Moreover, the rotation of the hip may differ if it is tested in flexion or extension. This is particularly in the case abnormality of the femoral head shape. As you know from this case, the labrum can become torn. This is a picture of a radial flap tear of the labrum, as described by Lage et al. In June of 1996. This is the radial flap tear right here. You can see the articular hyaline cartilage here. The cotyloid fossa is here. And down the bottom is the transverse acetabular ligament. In this slide picture, we are now looking at a peripheral longitudinal labral tear. In this case, the tear is in the superior portion here, and you can see basically the same structures. Finally, the radial fibrillated labral tear, also described by Lage, is your radial flap tear. Here you can see that we've got some degenerative changes. It's actually being torn and pulled into the joint itself. Returning to the slides of the hip itself, we can now see the ischiofemoral ligament. The ischiofemoral ligament arises from the ischial component of the acetabulum below and behind the hip joint. Fibers pass horizontally behind the joint, converging on the upper lateral aspect of the femoral neck. This is the transverse acetabular ligament that we saw in a previous view on this. And here we're seeing the continuation of the capsule, both inferiorly and superiorly, of the hip joint itself. As you know, in any type of synovial joint, you're responsible for understanding that there is what portions are vascularized, innervated, what type of fibers and nerve fibers are there. Please keep that in mind. At this point, we are now looking at the capsule of the hip joint in its entirety. This blue structure here, the iliopectineal or iliopsoas bursa. This is where, if you can imagine the muscle of the iliopsoas coming down, and it's going to rub right here on the anterior portion of the hip joint and its capsule, and you can develop this bursa in this area to help protect and reduce less friction as the muscle continues down over that structure, attaching here to the lesser trochanter. In this view, what we have done is we've basically removed a portion of the capsule. This now exposes the iliofemoral ligament. Iliofemoral ligament is sometimes referred to as the Y ligament. It is a broad, thick, triangular band that attaches proximally to the anterior-inferior iliac spine and acetabular rim and distally to the intertrochanteric line. The ligament is thicker towards the edges and thinner in the middle. Its medial band is vertically orientated and its lower end attaches to the medial end of the intertrochanteric line. This ligament is what helps suspend our paraplegics in the air when they are standing upright using their extremities. This ligament will keep them, when they thrust their hips forward, it will essentially keep them upright and erect. This is the pubofemoral ligament. Pubofemoral ligament is also a triangular band. Attaches to the iliopubic eminence, superior pubic ramus, and the pubic part of the acetabular rim. It passes distally to blend with the inferior aspect of the hip joint capsule and the underside of the femoral neck. It is taut in extension, which of course the Y ligament is also taut in extension. This structure here is the ischiofemoral ligament. The ischiofemoral ligament arises from the ischial component of the acetabulum below and behind the hip joint. The fibers pass horizontally behind the joint, converging in the upper lateral aspect of the femoral neck. Going back to look at this lateral type view, we are staring at the iliofemoral ligament, the capsule of the hip joint itself, the ischiofemoral, and that's the pubofemoral there. This, of course, is the synovial membrane inside the capsule. What we're going to do now is we're just going to take away those ligaments. Here's the iliofemoral here. Here's the ischiofemoral there. And that's the pubofemoral ligaments, just to keep you orientated to where we are. There's the capsule. There's the synovial membrane. Remove the synovial membrane. We can see the hyaline cartilage of the femoral head. And now we've kind of dug away and removed the head now, so we can see a little bit more into the acetabulum. So here is the ligamentum teres. Ligamentum teres, or ligament of the head of the femur, is a flattened band. It attaches to the fovea on the head of the femur, and the two bands attach to the base on either side of the acetabular notch. It lies in a synovial sheath. The ligament is taut when the thigh is semiflexed and adducted. A small artery is present within its substance. Here is the intra-articular fat pad within the acetabular fossa. There's a shallow depression in the floor of the acetabulum above the acetabular notch. Here is the articular cartilage here, and then this would be the acetabular notch here. You can see the blood supply to this area. This is just a quick recap of the ligaments of the hip. Pubofemoral, we discussed already. Turning it slightly, we get to the Y ligament, the iliofemoral ligament, the ischiofemoral ligament,